Assalamu alaikum. I am Dr. Silvia Paroi, Assistant Professor of Community Medicine Department at the Akij Medical College. Today we start the first lecture of Epidemiology in Community Medicine. At first we know about the definition of epidemiology. What do you mean by epidemiology? The study of the distribution and determinants of health-related states or events in specified populations and the application of this study to the control of health problems. Actually, epi means among, demos means people, and logos means study. So, in one sentence, epidemiology means study among people. Aim of epidemiology. Ultimate aim of epidemiology is to lead to effective action, to eliminate or reduce the health problem or its consequences, and to promote the health and well-being of society as a whole. Now we are going to know uses of epidemiology. At first we to study historically the rise and falls of disease in the population. Second, community diagnosis, and then planning and evaluation of programs, evaluation of individuals' risk and chances, syndrome identification, completing the natural history of disease, and searching for cause and risk factors of disease. Components of epidemiological studies. There are three components are common to most of them. First, studies of disease frequency. Secondly, studies of the distribution of disease. And third, studies of the determinants of disease. Now we see what do you mean by disease frequency. Inherent in the definition of epidemiology is measurement of frequency of disease, disability or death, and summarizing this information in the form of rates and ratios. Example, prevalence rate, incidence rate, death rate, etc. Thus, the basic measure of disease frequency is a rate or ratio. Secondly, we see distribution of disease. To study these distribution patterns in the various subgroups of the population by time, place, and person. An important outcome of this study is formulation of an etiological hypothesis. This aspect of epidemiology is known as descriptive epidemiology. Then we know about determinants of disease. A unique feature of epidemiology is to test etiological hypotheses and identify the underlying causes of disease or underlying causes, or we can say risk factors. This aspect of epidemiology is known as analytical epidemiology. Know about the epidemiological approaches. First, we know about the asking questions 5W and 1H. 5W means who, what, where, when, and why. And secondly, we use the approaches that making comparisons. Comparison of two groups. One group having the disease or exposed to risk factors, and other groups not having the disease or not exposed to risk factors. Secondly, we can compare between individuals. Now we see the measurements in epidemiology. That means what measurements we can use in epidemiological study. Firstly, we can measure the mortality. Different type of mortality we can measure by epidemiological study. Secondly, we measure morbidity, measurement of disability, measurement of natality, measurement of the presence, absence, or distribution of the characteristics or attributes of the disease. In 6, measurement of medical needs, healthcare facilities, utilization of health services and other health-related events. Then we can measure the presence, absence, or distribution of the environmental and other factors suspected of causing the disease. And then we can measure demographic variables. That's all in my first lecture. Thank you, everybody.